Hi everyone, good morning. I'm Dr. M. Hussain, consultant dermatologist and aesthetic practitioner working at Lamar Aesthetics, Gulshan, Dhaka, Bangladesh. Today I'm going to talk about the effects of PRP therapy in case of hair loss. First of all, we're going to talk about what is PRP. PRP means platelet-rich plasma. The person whom we are going to treat with PRP, at first of all, we will take 10 cc to 20 cc blood from that patient. So after drawing the blood, we are going to centrifuge the blood. So after centrifugation of this blood, we will separate the plasma from red blood cell. In the plasma, our target component is platelet, and the platelet derived growth factors. As you already know, that platelet secretes so many growth factors are very much helpful in case of hair treatment. We must say this platelet rich plasma, PRP therapy for hair loss treatment, is a magical one, because this is a natural process by which we can stop the hair loss, as well we can regrow the hair. So many people want to know how long it will take to regrow their hair. So usually one session in a month and 3 sessions may be sufficient to regrow the lost hair. For some other persons it may take to 3 to 6 sessions even, depends upon the condition of that patients. And if there is no local disease like any viral, bacterial or any fungal disease on the scalp or any systemic disease, this PRP therapy is effective. Some people want to know what is the expected regrowth of the hair. Suppose if you have 50,000 hair at your scalp right now, so at this point if we start this PRP therapy and there are live follicles over there, so 20% here are going to come back at your scalp hopefully. Sometimes this percentage may raise to 30 for 10, even then 50%. So some people want to know, is there any side effect after giving the PRP? No, there is no side effect usually. This is 100% safe, as it is a completely natural procedure. Some people want to know, is there any specific precaution or any preparation is required before going for PRP therapy? Usually there is no preparation for taking PRP therapy, but adequate amount of rest and drinking water is essential, and be stress free, because if you are in stress that you are going to have your PRP on tomorrow, so this is going to be less effective, as it secretes more stress hormone. So the platelet derived growth factors will work less if you are more stressed. So be stress free and drink adequate amount of water and just sleep adequately before going for your PRP therapy. You can easily continue your daily works even after taking the PRP. Just take few minutes rest, and after that you can continue your normal daily works. Some people want to know, is there any difference between the male PRP therapy and the female PRP therapy? Actually, this is the same procedure for male and female. There is no difference between the PRP therapy in case of male and female, but there are some differences in case of the treatment category, because there are some specific reasons for the female hair loss and the male hair loss. So doctor will decide how they will start the PRP therapy to that affected patient, and as well, if it is required, we will give some vitamin supplementation, inject some additional growth factor with PRP, but it depends upon the condition of that patient. In short, I must say that PRP therapy is safe, risk-free, and definitely more effective than other hair treatment available right now. Some people want to know the contraindication of the PRP. The person who cannot take the PRP, so there are some certain condition when we cannot offer the PRP to the patient, like if the patient is suffering from any type of cancer, he or she is taking any kind of chemotherapy for the treatment of his ongoing cancer, if the patient is in pregnancy, and if there is any medication like blood thinner medication, aspirin or any other things for cardiovascular diseases, like if the patient is suffering from the ischemic heart disease, and if he has any local or particular disease, we have to treat that first, then we will start the PRP. And some people want to know about if he has any systemic disease like high blood pressure and endocrine disorder like hormonal disorder in case of thyroid hormone and any other hormones. So yes, with the hormonal imbalance, still we can do the PRP, but we have to correct any hormonal imbalance, then we can continue the PRP. And the last question is that some people want to know about the cost of PRP. It depends actually where you are taking the PRP and from which doctor you are taking the PRP therapy. because some place to place definitely it will vary. And number two, it depends on other factors, like if the doctor is taking the blood into that into a particular PRP kit where there are some other additional growth factors, it will cost more. And if they are taking into the simple test tube, that will cost less. And another thing is that in case of centrifuge machine, here we are doing the PRP therapy in a machine which is FDA approved, and some other persons also doing their centrifugation which is a manual centrifuge machine. Definitely that will cost less. In rough, we can say the range is from 4,000 to 12,000 to 13,000, like that. And so your doctor will decide and the center will decide. So come to your treating doctor at the right time, take PRP therapy and regrow your lost hair. Thank you everyone. See you.